Good afternoon, everyone. Thank you all for joining us for this great topic on Medicare's alphabet soup. I'm joined here today by Robin Morris, who is of Medicare Essentials, to provide us with this presentation. My name is Annie Siegel, and I'm the Director of Special Projects at NASW New Jersey, and I'll be co-piloting this webinar with Robin today. So a few things before we get started. If you have any questions or comments, feel free to put them in the chat box, and I will be fielding those questions over to Robin, but we'll also have plenty of time for you to ask questions live at the end of the webinar. If you have any issues with seeing or hearing the presentation, you're welcome to leave the Zoom room and come right back in. We'll be sure to let you in. And just be aware that this webinar is being recorded as well as simulcast onto Facebook, so keep that in mind when speaking or when putting questions or comments in the chat. And also we ask that you remain muted for the duration of this webinar, just so we can reduce some of that background feedback that's going on. And without further ado, I will hand it over to Robin.
Thank you, Annie, and thank you, Jeff, and thank you, the NASW community, for inviting me and allowing me to speak during your brown bag meeting today. I'm really excited. Hope I can bring some enlightenment to those who kind of get lost a little bit with Medicare. I'm just going to tell you a little bit about myself and get started very quickly. So I am a Medicare benefits consultant slash agent. I've been helping clients. I've been doing Medicare for now 4 years. I had my health license for about 7 years, transitioned from health insurance to life insurance, then to Medicare. And I really really enjoy it. It's very rewarding, helping a lot of seniors and Medicare beneficiaries navigate and get the help and for their healthcare needs. I do work with some communities, lots of communities and organizations with helping those seniors. I do presentations like this, educating about Medicare. I find that a lot of seniors that are on Medicare don't actually sometimes know or realize what they have. I like to say all the time that a lot of people think that when they get Medicare, that they've reached the promised land, which Medicare is good. Some insurance is better than no insurance, but it can become costly if you don't really know how you can benefit otherwise. So without further ado, I'm going to just go ahead and get started with our Medicare alphabet soup session. Pardon me, I am a little bit nervous, but it's not uncommon. So what I'm going to go over today is help to know the difference of different parts of Medicare, how to avoid potential penalties, how to apply for prescription assistance, and is home health care covered. I may also have 1 or 2 questions for you guys as far as what you do and understanding a little bit about that as I go through. So very basic, original Medicare has 3 parts plus 1, I'm going to say. Part A, Part B, and Part B. Part B and Part D. A covers the inpatient Medicare covered services such as hospital stays, hospice, skilled nursing facilities, and home health care. Part B covers outpatient covered services such as doctor's visits, specialists, blood work, scans, things that usually would just go in and out to have done. So I like to say it this way. Part A is in, Part B is out. If you can remember that simple rule, that'll pretty much help eliminate a lot of what those are. So again, A is for inpatient, B is for outpatient Medicare covered services. Now, when someone is eligible for Medicare, that it usually starts at the age of 64 years and 9 months is when they become eligible. This is in my way here. So during that time, they're able to enroll in Medicare. However, their Medicare would not become effective until the month of their birth date. Okay, so that's the timeline. So it would be 3 months prior to their birth date, the month of their birth date, and then 3 months after is the timeline that they have to enroll in Medicare. Once they've enrolled in parts A and B, it's very, very, very important that whether or not they take prescriptions, that they get a Part D, which covers prescriptions through a private insurance carrier, which is contracted through Medicare. The reason why that's important, and I'm going to probably jump the gun a little bit, but if someone applies for Medicare, they have their A and B and never apply for B, never apply for a D, and don't have what Medicare considers credible coverage, or I'd like to say Medicare credible coverage according to Medicare, they may face a penalty, which those penalties are lifetime penalties, unless they can prove otherwise that they did in fact have coverage. So having A and B, needing to get Part D, and if they don't have a Medicare covered prescription plan with something like an employer. Sometimes people are still working when they turn 65 and get on Medicare, and maybe their employer cuts off their health medical benefits, but not the prescription, such as certain states may do that, or certain companies may do it for whatever their reasons are. And so that person may keep the prescription with their company prescription plan. If someone needs to know whether or not their company's prescription coverage is considered credible coverage according to Medicare, then they would want to reach out to their HR administrator, who would be able to basically confirm and tell them whether or not the coverage that they have for their prescriptions is considered credible coverage according to Medicare. So that's the very, very, very basic. Then sometimes the question comes up, well, if someone turns 65 and they're still working and they get coverage through their employer, they still have their health care coverage through their employer, and they get the prescription coverage all bundled together, do they have to apply for Medicare? The question is no, but I do advise that even with that, having the coverage, that just for good measure, to just double check with their employer, their HR administrator, to be sure that they do in fact have what Medicare considers credible coverage. I just always put that in there just to be safe. So that's what I recommend. I don't like to guess and say, just answer and say, oh yeah, sure, you're good. I just always refer them again, and sometimes if needed, I have and will and do conference calls with my clients who have questions that we need clarity on, and we do conference call directly with Medicare. Let me just back up. I didn't mention that I'm not a government agency or affiliated with a government agency. I am a dependent agent and Medicare benefits consultant. I am required every year to be certified to be able to offer any Medicare options. Medicare wants to make sure you know what you're doing before you do anything with anybody about Medicare. They have very strict guidelines as to how you approach, or I can't even use the word approach, how you get clients, I guess, work with Medicare beneficiaries. So it's important that we know the rules and we follow the rules, or else there are very stiff penalties and consequences for not doing it by the book. So I just wanted to put that in there. But I was saying that I do conference calls if needed, just to get some clarity If someone, well, I have this, and I had one offer that a gentleman, he said, why have something with the post office, and they have Medicare and a lot of other things he had going on. And I was trying to tell him what I knew, and he insisted that he knew different. And so it was important that we called to get clarity to know the difference. And so there are those situations and circumstances that from time to time I do come across. I'm not afraid to go to Medicare to ask questions. I know that sometimes a lot of seniors sometimes are beneficiaries. One, sometimes don't know what questions to ask. Two, they have to call and wait for long periods of time to get answers. And then sometimes when things are being explained to them, they don't quite understand what's being explained to them, and they don't always have someone there to kind of interpret what's being explained. And so that's where I come in helping a lot of clients with their Medicare. The other thing about Medicare is that whenever, let me go to this part here. For Part A, if an individual has worked 40 quarters or 10 years for their Part A, it is considered premium free, which means they don't have to pay a premium. Most people don't pay a monthly premium for Part A, which is sometimes called premium free Part A. But again, that's required. If they work less to get premium free, that's required. But if they've worked less than 10 years, then there is a premium that they would have to pay once they enroll in Part A. There's a formula for it. I don't have the formula to say this times that equals the amount that they would end up having to pay. But they would have to pay a premium if they haven't met the 40 quarters. Part B has a premium as well, which some of you, if you have clients out there that have Medicare, if you have some who are having some hardship issues or really time, paying bills that they might share with you while you're caring for them in whatever way that you do. You may hear them talk about Part B and how do I get rid of that? Do I have to pay that? Why am I paying that? It does have a premium of $148.50. It goes up every year. It went from $144, I believe, and changed last year, up this year to $148.50. It will probably go up again in 2021. And that automatically gets taken out unless someone wants to be billed. Usually billing is quarterly. However, if someone is needing to pay their premium or wants to pay their Part B premium monthly, they can call to request to receive a monthly bill to pay their Part B. So that is also an option which some people may or may not be aware of. There is also a deductible this year of $203 after the deductible is met. Typically, there's 20% that the Medicare beneficiary is responsible for. 20% doesn't seem like a lot, but if someone's on fixed income and they're having to go to doctor's appointments and specialists and this and that, it can become pricey or costly over time. That's a lot of what I find myself running into. Sometimes what has happened is that individuals, there are some that they've been on Medicaid disability most of their life, or state disability, let's say. And now they're 65 getting on Social Security disability or what have you. And then, or they've been on Social Security disability and they get on Medicare, Social Security retirement, their income changes, they lose their Medicaid, they don't know what to do because all this time Medicaid has been picking up the difference that Medicare covered services weren't paid for. They don't know how they're going to pay. A lot of times they don't realize or know that they may be able to reapply to Medicaid. They may still qualify to reapply. And that's something else that I also do as I do assessments with all of my clients to find out exactly what their needs are, what they're having challenges with, and what they need help with. so that I can kind of insert and help them apply for Medicaid, should I see that they qualify, or if they're finding they're having issues with their prescriptions, which many of you may know, diabetics, sometimes cancer patients, all types of patients with different ailments from time to time run into issues with being able to afford their medications. I'm kind of jumping around a little bit and I don't want to get ahead of myself, but when I come across a client that's having some hardship issues and wants to know if they qualify for assistance, as part of the assessment, I do that and then let them know that what they may be able to qualify for. And then I complete an application with them, submit the application, follow through with them to know whether or not they were approved, if we need to call to find out what's going on with their application, if more information is needed. So there's a lot of follow-up work that I do. Even as an agent, I find myself doing a lot of social work, which is very rewarding, and I really don't mind doing. Let me see if I missed anything. Okay, so I am in New Jersey. I was in North Carolina, but I'm not in North Carolina. What I will say is, pausing here from where we are, if anyone has questions at any time, regardless of what state you're in, if you find that you have clients that you know need help and you like to refer them to me and I'm not in that state or whatever it is that I might be lacking to help them, I may be able to still accommodate based on your needs. But we would need to have a discussion for you to let me know what the needs are for your clients so that I can let you know how I might be able to accommodate. And if nothing else, if for some reason I'm not able to personally, then I can pretty much steer you in the right direction as to where you might be able to go or what have you. Sometimes for me to be able to take on other states, it might be a matter of days, 7 to 10, something like that, for me to get credentialed for what I would need to help in those other areas. I'm currently not in New York. I have a relative in New York. I try to get them to kind of shop for me, but it kind of went to pot and nothing ever came of it, so I didn't go out to New York. But I am in Delaware, New Jersey, Maryland, and Pennsylvania. So let me just move on. I forgot to mention, I think I did mention about having credible coverage according to Medicare when considering enrolling in Medicare Parts A and B. If someone doesn't have that, then yes, enroll in Part Medicare A, B, and D. If they do have it, make sure that it is considered credible coverage with the employer, and they should be good to go. And so that's what this is saying here. Am I going too fast? Any questions so far?
We did have one question that came in that somebody asked if the Medicare is universal, in that can you use it in any state, or does it have to only be in the state that you're currently in?
Medicare is accepted by doctors who are contracted to accept Medicare patients. So if the doctor accepts Medicare, then they can use their Medicare. Did that answer that question? So in that way, so if someone happens to be in New York, but they come to Delaware and God forbid has to go to the hospital, they're going to ask them what insurance that they have, and they say Medicare, they're going to give them their Medicare card and basically bill Medicare. So Medicare is not state specific, it is federal.
Okay, great. So it'll work no matter where, if you're traveling or anything
nationally,
like
that. Nationally, yes, in the States.
All right, and then someone else had asked, how much time does a person have after losing employer coverage to apply for Part B?
They have employer coverage for Part B as in Bob, I have two timelines in my head. I'm thinking about the Part D, which is 63 days. Employers, and I'm going to triple check myself. I want to say, are they referring to their healthcare coverage?
Yes.
Okay. I'm going to say 8 months, but I'm going to triple check myself. I always triple check myself, always, because I don't want to give any misinformation. So yes, there is a timeline that someone does have should they lose employer coverage. I know a lot of times people are not going to wait that long to get healthcare coverage. One moment, please. Let's see. I'm sure that's the answer, but I still always like to. Okay. Okay. One moment. I'm sure that's the answer, but I have to. I don't like not giving the right answer. I'm going to move forward and I'll come back to that, but that is the answer. It's 8 months. Does that answer that question? Was there another question?
Yes, there's another question. Somebody asked, how is Medicare monitoring what is credible and applying penalties? You said that the premium comes out automatically. Automatically from where?
I'm sorry. So if someone is getting their Social Security retirement benefits, or if they're getting Social Security disability, and they're enrolled in Medicare, which in order for someone who is on Social Security disability, they would have to be on for at least 24 months, and then they would automatically be enrolled in Medicare. Once that happens, then the Part B premium would automatically come out of their Medicare, would come out of their disability benefits. It is a little bit different for those who are retiring. And for those who are on Social Security retirement and enrolling in Medicare, they may have the option to either have it come out automatically or be billed to have it come out. The same may be possible for Social Security disability. I haven't had that instance. So that would be a question that I would definitely follow up on to know if they could be billed rather than have it come out automatically for those who are on receiving Social Security disability benefits.
Great, thank you. And one more question before you can keep going. How soon after 65 does a person need to enroll in Part B if they don't have employer coverage and is Part B the private companies? Is this the same answer as you had said before, 8 months?
So how soon, what was the first part of that? How soon?
How soon after 65 does a person need to enroll in Part B if they don't have employer coverage?
Okay, so you have 3 months before your birthday. So if someone was born, this is where we know, this is July. Let's say someone's birthday is in September, right? So they would have June, July, August, the month of their birthday, September, October, November, December. So I always advise ASAP, like don't even second guess yourself. Just when you turn 65 to, if you're not sure before the month of, definitely get in there.
All right, and I think we can keep going for now and I'll keep monitoring the chat with more questions.
Okay. Moment. I'm just writing some things down here. Okay, so then these are some things that Medicare does not cover. Some of you may have found this with the clients that you work with. And I think I need to understand a little better. Are all of your social workers clinical?
No, not all social
Clinicians?
workers are clinical. Social workers can work in a wide variety of different practice settings. So some may not inherently be working in a clinical setting.
Okay. Okay, thank you. So you may have found this when, for any of you who may have ventured out a little with trying to help some of your clients, Medicare doesn't cover everything. Some of the items or services Medicare does not cover are long-term care, also called custodial care, most dental care, eye exam related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting them, and routine foot care. Are some of the things that it does not cover. Which now takes me to, which I kind of should put this one prior, but we know that Part D does cover your prescriptions for outpatient prescription drugs. We did talk about that. Now, should someone, for whatever reason, let's say they did have employer coverage and they did lose it, we talked about how long they would have to get a Part D, as in David, that one is 63 days. That's important. I've had a couple of people who said, well, when I went on Medicare, I wasn't on medication, so I didn't get a prescription plan. And that's why I mentioned initially that regardless if anyone's taking medication, they enroll in Medicare A and B, they are required to get a Part D prescription drug plan to avoid the penalty. Okay. And again, the only way of getting rid of that penalty is to be able to prove otherwise that you did have that coverage, credible coverage according to Medicare for your prescriptions. So now we talked about the parts that Medicare doesn't cover, but this is where Part C, a lot of people ask, well, what is Part C? What is Part C? Part C is everything that you see advertising on television, especially during annual enrollment. The Humanas, the Cignas, the Aetnas, all of the brands that you see commercialized. That's the part that they're offering Part C plan options. Part C bundles most of the time with the Medicare Advantage plans, Parts A, B, and D. They cover supplement benefit options such as vision, dental, hearing, over-the-counter, which is relatively new, fitness, and other options, I like to call them healthcare options or services that one may need or want. Part C, as mentioned, are Medicare Advantage and Medicare supplement plans like the infamous AARP, slight advertisement, I guess, mentioning their names, plans provided by private companies or insurance carriers. Now, when someone decides, there's two questions. Why would someone want Part C? Well, as mentioned earlier, they have 80% that that Medicare covers with original Medicare, having Parts A and B. Medicare covers 80% of the Medicare covered services, and then the beneficiary is responsible for the 20%. Well, 20% doesn't sound bad until, again, someone starts having issues of having to go a little bit more often, or even if they do go and they get a doctor bill that's more than what they expected having Medicare. The Medicare Advantage plans, I like to say, are like your employer plans. However, these Medicare Advantage plans may or may not have a premium. You have your copays for your doctors, your specialists. Sometimes some of them offer zero copays for your primary. So you have your copays, your co-insurances. Some have deductibles, some do not, things like that. So I like to say that they are similar to your employer plans. So though I'm sure you guys have employer plans and you know pretty much how they work. So you have your copay, you go to your doctor and you're done. Now, getting the Part C does not get rid of Medicare, because I've had people, well, what's going to happen to my Medicare if I get Part C? Nothing. You have to have Medicare in order to enroll in a Part C plan option. So that is required in order to even consider going into a plan option. And again, it does cover your Part A, your inpatient Medicare covered services, your outpatient, and your Part D. And in my mind, I find that to be very cost effective compared to original Medicare. There are a lot of options out there. Sometimes people don't know, well, what plan do I choose? Which one should I go with? There's this one, they say that. There's this one, they say this. Well, they said on TV that I might be able to get this, or my cousin or my friend or neighbor, they're getting this. How can I get that? And I try to tell my clients two things. Number one, what you're seeing on television, they're going to say you may qualify. So may is a key word, or you may be eligible. Doesn't mean that you will be, you may. The other thing is that what you see on television is great. However, if someone's in New York or in New Jersey or in Delaware, and they're seeing these options that might be available to them, they're not going to call that number. And let's say they already have a plan and they call that number, you're not going to get something better out in California or out in Arizona, because the plans are state specific. So whatever state that you're in, and then narrow down to the county, they're only going to be able to offer you the options that are available in your particular, in your area. So sometimes it can come across, a little bit flashy and sound really good. And it does work well for some, but maybe not others. And so that's why I also like to come in, because that's when the question comes in, well, which plan will work best for me? And that's why I do the assessment, figure out what the options are. I try to make myself credentialed for options for the states that I'm in. So that should someone come to me, then I can basically shop for them and eliminate that stress, part of my motto, of having to try to figure out, which one works. Sometimes I've had customers who have experienced calling the numbers, and it's important a lot of times when individuals go for these plan options that their doctors be in network. They don't want to have to change their doctors. They want to be able to go to the hospital that they're going to, their specialists. How much are they going to pay for their prescriptions? Is that going to change? People don't want to change. They want everything to stay the same, but try to get something more cost effective. But I have had individuals to tell me they called this number and they told them their doctor was in network, and lo and behold, they got the plan, went to the doctor didn't accept it, they couldn't see the doctor. So, or they may have seen the doctor, but they had to either pay or whatever happened. So there's been some misinformation from time to time. That's why it's good to I like to say, come to someone who's kind of known or knowable. You would hope that if someone does call that they are giving proper information. Not to say that everyone is not, but there have been those instances. And so that's why I make myself available and accessible, even after helping someone to get into a plan option, which has happened from time to time. Time is running out. So that's a little bit more about Part C. Now, the supplement plans, as I mentioned, are kind of like the infamous AARP type of plan, where they have supplement, I call it, is like an umbrella. And under that umbrella, you have plans A through N. And then you have to look at, just as shopping with your insurance, employer insurance, you basically shop them to find out, well, what are they offering? You look at the chart to see, this is what they offer after I pay a deductible, 50%, 80% for this, and that. There's a number of plan options that one can choose from under the Medicare supplement. One of the other stark differences is that with the Medicare supplement plans, there's one plan under that umbrella in particular. It's like Plan G is in George, for example. Let's say someone turns 65, they don't want a Medicare Advantage, they don't want to have to pay anything when they go to their doctor, they want a supplement plan. The supplement plan does not bundle like the Medicare Advantage does. It covers parts A and B. And then individuals have to get a standalone Part D prescription drug plan. Also, the Medicare supplement, it's actually best or works best when someone is just turning 65 to enroll into those types of plans. I say work best financially because when you're first going in, you tend to get a more comfortable premium going in than you would. Let's say you're 68 years old, you've had a Medicare Advantage, you now want to switch and get one that your friend has, and they're only paying such and such amount. Well, after that, after you've missed that open enrollment period or the guaranteed issue, which I don't want to get too technical, and you want to apply for that type of plan, you want to, of course, keep the Advantage plan that one might have. When you enroll into the supplement, you'll have to go through underwriting. Which, of course, we know that can sometimes affect the premium that one would have to pay for a Medicare supplement. So those are the differences. Now, the Plan G, for example, someone turning 65, they want a supplement, they get this Plan G, one of the plans under that umbrella. They pay their premium every month, about 100 and some, whatever it is a month. It goes up every year. Some of them go up twice a year. They pay their premium, they go to their doctor, show their card, and they're done. Some of them have a deductible. I think G does also have a deductible. I haven't looked at that for a moment. I don't do a lot of those, but I have some that I have done. But those are the differences. And again, neither of those replaces Medicare. You have to have Medicare to even be considering getting a Plan C, a Part C option. The reason why I'm emphasizing that someone doesn't lose their Medicare is because I had a lady, she was older, this lady was in her 80s. She called for help. She was having financial issues, hardship issues, paying her supplement plan. Of course, you can imagine when she started, it probably was about 100 or less. Being 80 some years old, premium was about 300 and some dollars. She's on fixed income. She had since applied for Medicaid. So she had both Medicare and Medicaid. Of course, Medicaid picks up what Medicare doesn't. Well, for whatever reason, someone along the line told her by the time I got to her that if she got rid of her supplement plan, that she would lose her Medicare. I tried to assure her over and again that she would not. She insisted on keeping her supplement plan paying $300 and something odd a month that she couldn't afford, which has probably since gone up, all because she believed what someone else told her about her losing her Medicare if she cancels her supplement plan. And so that's why I emphasize that, because sometimes people are being misinformed. Any other questions so far?
Yes. So somebody had asked to clarify the question that you had answered earlier regarding how Medicare is monitoring and applying penalties. They're curious about how they're applying penalties portion of that question.
I'm sorry, I didn't get it. I'm sorry about that. That's a great question, how they're monitoring. You mean from going from employer to Medicare, you said?
The original question is, how is Medicare monitoring what is credible and applying penalties? If the person who asked that question wants to unmute and clarify, that
would be great. I think I understand, but that would be great.
If somebody doesn't have any coverage, are they being monitored, or is that only when they go to sign on?
Right, so it'd be when they go to sign up. Sometimes it happens to be a catch-up game, because I have had individuals who for whatever reason, they didn't sign up for Medicare. But when they finally want Medicare, Medicare wants to know, well, what have you had all this time kind of thing? Does that make sense? And especially with the Part D, oh, well, you know, what did you last? I really don't know their dynamics of what and how they're able to know. I haven't had a situation like that. That's a very good question. If you'd like, I can follow up to find out, to see if I can get that information. But the best that I could answer that is to say that if you turn 65 and you don't have any employer coverage and you finally turn 67 and finally for whatever reason want to get it, again, I believe it becomes a catch-up game. Well, kind of like, where you been? You know, that's how I understand it.
So it's only if you come to their attention because you're trying to get coverage later.
Basically, yes, is how I understand that part of it.
Okay, thank you.
Yeah. But again, if you want to reach out to me, I am going to put my information in the chat. I'm always available Monday through Friday from 8 to 6, Saturdays 9 to 1. Let me just put my phone number and email in chat. That's the phone number and the email address. I also have on my website a referral link, or even if you feel like you want to need a one-on-one, maybe you have another group of individuals that you work with and you guys would like to kind of get more information or have other questions, I'm available to do that as well. Let me just put this in here. I don't know if I said in the offset currently who I work with. That is, I think I did say that, right? I did say some, yeah, I did. Okay, some of the businesses and agencies I work with. But yeah, hopefully that answered that question. Are there any questions about Part C?
What is the best way or resource for a client to identify which Part C plan is best for them?
I am. Aside from me, of course, there's Medicare.gov to help them find plan options. But, you know, sometimes it's good having a live person because then you get questions answered and things like that. Yeah, so that would be the one of the, probably next to me, the second best way, but that's just me. That's a joke. But yeah, so that's why I offer shopping for customers to pretty much sometimes see what they have compared to know what might be available. Some customers that you might have that have both Medicare and Medicaid say, oh, well, they're good. They don't need anything. Well, that's all fine and well, and they probably, quote unquote, don't. But there are other benefits that they also may be lacking, as mentioned, some of the supplemental options that are available with the Part Cs for those who are both on Medicare and Medicaid. Then I'm going to go to one last slide after that. One of them is the over-the-counter card, which allows them to go to a pharmacy and use it literally for over-the-counter items, pain medications, creams, wraps, thermometers, and some other over-the-counter items. There's a catalog that they would get, as well as some of them these days are even offering health cards where they can buy fruits and vegetables. Sometimes they also offer where they may be able to get one of those Life Alert, well, not the brand Life Alert, but one of those button to alert for ambulance or help, or get one of those installed in their home at no cost. So there are a lot of other benefits that those who are on both Medicare and Medicaid, while they are pretty much well supplied with their medical services being covered, that there are other benefits that they could also be taking advantage of. And I get really excited when I I'm able to help those, and I have not had one that has not been happy when I'm able to, what I like to say, accelerate or enhance their benefits. So that's another big deal. The last thing I'm going to go over is timeframes for when individuals can enroll. We talked about initial enrollment, turning 65, 3 months prior to your birthday, the month of the birthday, and then 3 months after. Then there's the infamous annual enrollment, which you'll see, as I mentioned, with all the infomercials and everything. You might have your clients, some of them who get calls all the time. A lot of scammers out there. I had a couple of people that have been scammed. One lady in particular lost 2 months of her Social Security. They even changed her insurance, however that happened. I think I had another lady recently got scammed. Somehow someone got a hold of her Social Security. She ended up having to pay money back or something. I forget what happened. Just, a lot of caution to be out there with them answering those calls and hopefully not giving out information, having enough wit not to do that. But that annual enrollment begins between October 15 through December 7. If they're enrolled in a plan, they can change, or if they're new and want to getting a Part C, have just original Medicare, they can do that at that time. Open enrollment is January 1st. Maybe they got a plan for whatever reason, they don't want it, they just want to cancel it, that they can do that then. Maybe they got a plan and they want to get a different one they heard about that matches the type of plan that they have, such as Medicare Advantage prescription drug plan to another carrier with the same Medicare Advantage prescription drug plan, or for one prescription plan to another prescription plan. That's what that time frame is for. And then there are special enrollments, which does require special events, such as events moving in or out of an area or losing coverage is another one. And then, as I recently mentioned, those who may be on both Medicare and Medicaid, or maybe they just got approved for Medicaid. Those who are getting prescription assistance, which I didn't get a chance to cover. But I will say that if you find that you have clients that may need help with their prescriptions, there's a program through Social Security called the Low Income Subsidy Program, also known as Extra Help. They do have to income qualify, but I do assessments for that and do the applications for that as well, follow up. Should they qualify and get approved, there's 4 different programs that they may be eligible for. One is I don't want to go through all 4, but it's one way that they can get assistance should they qualify for their prescriptions. And again, for more information about that, I'll be happy to go over all of the income requirements, resource requirements, such as checking accounts, stocks, bonds, things like that, that need to be looked at to be considered for qualifying for prescription assistance through Social Security, the Low Income Subsidy Program. That was a lot, and we're 10 minutes left on the clock. Any questions, feedback?
Yeah, we have a few in the chat that I can start to get through. So somebody asked, do supplement plans offer what a Part C plan offers regarding dental and vision benefits?
They do not. So the supplement plans do not. One would have to not only get a standalone prescription drug plan, but if they are wanting like vision and dental, hearing, things like that, they would have to get a separate plan. So they would have their supplement premium for their prescription drug plan, as well as a premium for those other supplement benefits. And a lot of times there are packages, as you may or may not know, that come with vision and dental. Some may be vision, dental, hearing, and there'll be a cost for that. The average cost is approximately, depending on where you are, $57 to $60 some starting and up.
All right, and somebody else had asked, can you purchase additional insurance if you have a Part C program already? Can you use 2 sorts of insurances as a form of payment?
No. with Medicare would not allow you to have more than one Medicare Advantage plan. Like you cannot have a Medicare Advantage and a supplement, or vice versa. You can't have two supplements or two Medicare Advantages. You can only have one. So you have the original Medicare and one of the Part C plan options.
Great. And then what is the difference between annual and open enrollment?
Yeah, so annual enrollment is for those who maybe they missed that initial enrollment period. Maybe their birthday was in April, and then they had all the way until, what's that, the end of July to get a Part C, and they missed it. They would have to wait for annual enrollment to get a Part C plan, a Medicare Advantage plan. It's also a time for those who may already have a plan but are not happy with it. They don't have a special enrollment period. Nothing qualifies them to change any other time during the year, which I didn't give the timeline for special enrollment. Special enrollment would be once per quarter, January through March, April through June, July through September. Once per quarter is when they can either enroll or make a change to the plan option that they have. So if someone does not have a special election and they want to make a change, they would have to wait until annual enrollment. Open enrollment is more for changes for those who do have, but they don't have the special enrollment, so they don't get any assistance or anything. They don't have a special event. And this is the time, for whatever reason, they missed annual enrollment. They wanted to change but didn't. They have January through the end of March to make that change, but it does have to be a like plan. So if they have a Medicare Advantage plan that does have prescription, they would only be able to go to another plan that has the same Medicare Advantage plan with a prescription drug plan. Or if they have prescription only, they don't like that carrier, for whatever reason, they want to go to another one, they can do that. But they wouldn't be able to go to prescription only, having original Medicare and prescription only, to Medicare Advantage, or prescription only to supplement. It has to be like, does that make sense?
Yes, it does. And then one final question that came in is, how do you protect somebody against identity theft or Medicare fraud besides not giving personal information over the phone?
That is a great question. One thing that Medicare has done, and I highly encourage, hopefully there are those many beneficiaries have received their card. Medicare has made it so that now, let me put this card, that the card looks like this. It has this letter number type of ID, whereas before it just had the Social Security number with the letter A or something at the end of it. If you have any clients that have that, they need to call Medicare to get their new Medicare ID card. That's one way. So of course, Social Security numbers and things like that, they shouldn't be using. But when it comes to protections from identity theft, when it comes to Medicare, I mean, that would be something for me to venture into to see if there is anything out there. I haven't heard of any protections other than, as you stated, not giving information over the phone. Did I answer that question?
Yes. And I think I haven't seen any more questions come in the chat, but if anybody has any lingering questions in our last few minutes, you can feel free to put that in the chat. But otherwise, thank you so much, Robin, for all of this information. It's definitely a very confusing topic that I think it's very helpful to have this info. And I know that hopefully we can share some of this information if you will be willing to share your slides with us so that people can have it in writing as well. Okay. And I'm going to put Robin's information once again in the chat, so you have that right at the bottom.
And if you have any one offers, sometimes people have certain situations for whatever reason, and they just want to know, well, this person has this, what do I do about that? What do they do? You're welcome to send me an email or give me a call. If I don't answer, I do return my calls, so I will give you a call back. But I'm happy and available to answer any questions, hopefully. If you do have any clients that you find are needing the type of help that I do offer, my services are at no cost. People say, well, how do you get paid? And the only way that I get paid is by helping those who want a plan option to get into a plan option that best meets their needs.
Great. Thank you so much. You did great for your for this webinar, Robin. We really appreciate it.
I'm still a little bit nervous, but yes.
Oh, no worries. We do have one lingering question right
Sure.
before we close out. So somebody had asked, does Part G cover everything in A, B, and D and additional coverage?
Part G covers A and B, Medicare covered services for that under the supplement plan.
Okay.
Yeah, and so if you want more information about that, I can go over whomever that is. You can give me a call or send me an email and I can provide you with more information about that. Again, all of the plan options part of the Medicare Advantages and the Medicare supplements, I do offer and help to shop once I do an assessment to find out what the needs are.
Great. Thank you so much. And everyone's extending their thanks in the chat as well.
Thank you. Thank you.
All right. Thank you, everybody, for joining us. We will put this recording. It will be available on our Facebook, but we will also post it to our YouTube as well. And we will be sure to email everybody a copy of the YouTube link as well as the slides. So I hope everyone has a great rest of their day and a great week. And thank you again, Robin.
Thank you for the opportunity to speak with everyone. Have a good day.
Have a good day.